No?
Yes, sir.
Why the veins? Absolutely. Through the veins, it can spread. Okay. To the other areas, not into the peritoneal cavity.
Select for you.
So let us see the injuries of the urethra over here today. Okay. So yesterday we have seen the urethra, male urethra, right? What are the components of the male urethra? What are the contents? I mean, what are the offshoots of the urethra, male urethra? What is it? Offshoots. That means any projections from the urethra. For example, you take the prostatic urethra, which structures are coming out or entering into the urethra? Yeah, what is the utricle? Prostatic utricle secretes mucus, absolutely. And then, so what is the swelling within the middle of the longitudinal fold? What is it? Pedomontal. Okay, I think you like the term. Okay, it's auricular seminalis. Okay, which contains three openings. What are those? In the center there will be prostatic utricle, and on either side there will be ejaculatory ducts. Ejaculatory ducts will be releasing spermatozoa along with seminal fluid. Spermatozoa will be released all the way from the testis into the vas deferens, but seminal fluid will be added by seminal vesicles and other glands also. Okay, we will discuss that later. Okay, and then okay, fine. So there is a urinary bladder just above this. So how can the urethra can get injured in case of the patients? The persons, how can various areas of the urethra can be injured? What right? Accidental fall on the perineum that leads to the injury to the either penile urethra or bulbous urethra or urethra, sponge urethra you can say. Okay. Over here, that is within the body of the individual or outside the body, the urethra will get injured over here. Getting it? So what happens if the urethra gets injured over here? For example, if it is getting injured over here, the urine will be leaking outside in that particular injury. That's okay. That can be clear because switching the water is fine. But what happens to the urine which is leaked over here? So it will be the urine will be leaked into the superficial perineal pouch. So till what extent it may reach the body? Till the axilla. What might be the route? How it can reach the axilla? How it can reach the axilla? See here, this is the skin over here of the anterior abdominal wall, which will be lying in front of the pubic symphysis over here, and then further downwards will be continuous with the perineal area. Getting it up, right? So, deep to the skin there will be which fascia? Superficial fascia, which contains fascia of Cameron, scalp and base of the abdomen. Okay. But here if you see, the superficial perineal pouch will be continuous till the axilla deep to the superficial fascia over here. Getting it out? For example, the superficial fascia is over here. This is the superficial fascia. The superficial perineal pouch can be passing, that means the urine which is leaked into the superficial perineal pouch can be passing deep to the superficial fascia and will be reaching till the axilla, because from here till the abdomen, till the groin, the superficial aspects will be the skin and the superficial fascia. Deep to that will be deep fascia, is it not?
No, sir.
No deep fascia is there. Deep to that will be muscles and aponeurosis. So in between the muscles and the superficial fascia there is a space, is it not? Alright, superficial inguinal, that's a different thing. It's okay. So deep to the superficial fascia will be the muscles over here. Get it? So the skin will be continuous downwards and continuous in the perineum below. Get it? So everywhere there will be superficial fascia. Okay. So the urine which is extravasate over here can be passing through this space and then reaches the axilla till this part of the thorax over here. Axilla. It reaches the axilla. Okay. For example, the urethra gets injured over here within the membranous part of the urethra. What will happen to the urine? So obviously this is a deep perineal pouch, so the urine will be leaked into the deep perineal pouch over here. So if it is within the prostatic urethra, what will happen? If it is within the prostatic urethra, what will happen? Where the urine will leak? Okay. Yeah, space of Retzius. So that will be linked into the space of Retzius, because space of Retzius will be in front and on either sides of the prostate and urinary bladder over here. Okay, so the urine will be linked into the what is it? Space of Retzius. Okay, then urinary bladder, if it is getting injured, for example, because there is a penetrating injury over here, the urinary bladder gets injured, so the urine will be leaked into the space of Retzius. Is okay. Any other? Paravesical fossa, that is nothing but the fold of the peritoneum. So indirectly it will be entering into the peritoneal cavity, leading to the peritonitis over here. Okay, urine is not, what is it? Urine is of course acidic and also it will be infectious also. I have asked you already the question, what is it? How the toxins of the urine can't reach the surrounding interstitium. How can it can happen? Uroplakin, what is that? Glycoprotein, which is lining? Yeah, but what is it? Transitional epithelium, okay, not the entire thickness of the epithelium. Only the umbrella cells, okay, but throughout the umbrella cells or only the not anterior surface, the luminal surface. Whatever the epithelium on the outer aspect, which is facing the lumen, will be covered by a glycoprotein that is termed as what is it? Uroplakin. Okay, that will not allow the toxins from the urine to enter into the surrounding tissues over. Getting it out here, right? So female urethra we will be discussing on Monday along with the female genital system. We will start the female genital system today. So at the end of the female genital system, we will discuss the urethra, which is a very small thing. Okay. So today we will discuss the female genital system contains ovaries and then two uterus, uterine tubes first of all, uterine tubes and then followed by uterus, this is part of the uterus and then followed by vagina. Okay, and of course female external genitalia. Okay, so ovaries, uterine tubes, uterus and what is this? Vagina over here. So we are going to discuss all these things in these 2 days. Okay. Today we will discuss ovaries and the uterine tubes. Okay. So ovaries are male sex glands, is it not? Female.
একটু পিটা বলে চশমা দিয়ে দেখতে পাচ্ছিস কি করে এইটুকু দেখাচ্ছে তো চোখে পাওয়ার নেই ওই জন্য এইটুকু দেখাচ্ছে ভাই জায়গায় পড়তে পড়তে মাথা খারাপ হয়ে গেছে হাতের মতো দেখাচ্ছে সব কিছু শেষ কটা আঙুল দেখাবি কটা 10টা ভীষণ ভাবে রেকর্ডিং হচ্ছে আর বলছি আরে ওর পিছনে বাড়ি যাবে বলছি কোথাও আমাদের দেখতে বাড়ি চলে যাচ্ছে জিজ্ঞেস করে আমি বাড়ি চলে গেছে ছুটি বলে আমার সঙ্গে আসবে তুই চ আমার সাথে
না ভাই আমার ইন্ট্রো দেওয়ার প্রচুর শখ ওই জন্য
এটা তো ভাইরা
হ্যাঁ ও আমার ভাই আমার ভাই এ ভাই প্রত্যেকেই আমার ভাই এরকম
ওরা দিদি
সবাই বোন ভাই
ওরা দিদি ওরা বেশি ভালো পড়াশোনা
এরা তিনজন আছে ভালো ভালো
আরে ওরাও দিদি সবাই দিদি
স্যার স্যার
ছবি তুলি আমরা
সেই আমাকে ছাড়াই তুলবি না
এটা
ফোন থেকে নিয়ে যাবো আর সেটা
তোর দিকেই ফেরানো ছিল দেখি ফোনে বল স্টিকার বানিয়েছি
ওই পাঠাবো ওই স্টিকারটা তোকে ওর একটা স্টিকার আছে আমার কাছে আমার আমি বানিয়েছি
দারুণ আছে
হ্যাঁ
হাইটেডের
টেরে গেছে বেঁকে গেছে
আরে এইরকম
বললি না সোজা হয়ে যেত এই আরেকজন হয়ে গেছে
সবাই লজ্জা করতে ছবি আছে আর আমি ফ্যাশন করে ঘুরে গেছি
So let us see. Come on, everybody. Let us see. First of all, the ovaries. How many ovaries are present in case of female? Two ovaries. Okay. One is the right one and one is the left one. Okay. So the ovaries are just like a testis, almond-shaped structures over here, which contains what we call borders and surfaces. It will be in this manner, just like the testis over here, which contains the okay. First one, upper end and lower end over here. Upper end is also termed as Q tubal end. Okay, upper end is also termed as tubal end. Okay, one thing you're supposed to remember over here is, first of all, if you take a sagittal section of the pelvic cavity over here, lesser pelvis over here. Okay, where is the lesser pelvis? Where is the lesser pelvis? Below the pelvic brim. Pelvic brim is formed by what is? Linear terminalis on either sides and then followed by sacral promontory is there, but what is the continuity? What is? Ale of the sacrum, anterior border of the ale of the sacrum. Okay, don't forget. Okay? So all the way from sacral promontory, anterior border of the ale of the sacrum, and two linear terminalis. Everything will be forming the pelvic brim. So in case of kids, above the pelvic brim, the ovaries will be situated. Okay, and in case of adults, the ovaries will be below the pelvic brim. Okay, development time. Okay, right. And one more thing you're supposed to understand over here is the fallopian tubes or uterine tubes are not horizontally directed. Okay, they are vertically directed. Okay, always try to remember the fallopian tubes are not horizontally directed. Why the fallopian tubes are not horizontally directed? What's the need? Yeah, bone can be transferred because of serial action. Okay. And what might be the other reason? For example, the fallopian tubes are around 10 centimeters. Okay, on either side, absolutely. So right fallopian tube is around 10 centimeters, left fallopian tube is around some 10 centimeters. In between that, this fundus of the uterus will be around some 5 centimeters. Okay, totally how many centimeters? Horizontally, all the way from right fallopian tube, fundus of the uterus, and then left fallopian tube, as a whole it will be 25 centimeters. So what is the diameter of the pelvic brim? Diameter of the pelvic brim? Over or not? Lecture class? Please over or not? Over or not? Okay, roughly you can say, not approx, not exactly, rough diameters you can say 10 to 13 centimeters you can say that. Okay, so roughly the pelvic brim diameter is 10 to 13 centimeters. Okay, so but here it is 25 centimeters of this entire length. So to accommodate this length, so these must be going above, vertically oriented, so that the length will be reduced over here. Getting it out? Or transverse diameter will be reduced over here. Okay, with respect to the pelvic brim over here. Getting it out? For that sake, the fallopian tubes are not horizontal, they are vertically oriented to accommodate the pelvic brim or pelvic cavity over here. Getting it out? That is the reason why the fallopian tubes or uterine tubes are vertically oriented. Got it? Right? So, towards the upper end is the fallopian tube. You can see that it is oriented over here. This is a ovary which is situated in the pelvic cavity, not outside the pelvic cavity. Ovaries are intraperitoneal. Intraperitoneal means within the peritoneal cavity. Okay. So, towards the upper end of the, so this is the upper end of the ovary and this is the lower end of the ovary. Towards the upper end is the curvature of this fallopian tube. So this end is termed as tubal end. Okay, and this is facing downwards over here. So that might be towards uterus. So you can call it as uterine end over here. This is the uterine end, and that is a tubal end over here. Or you can say this as towards the pelvic end also. You can say because it is facing towards the pelvic cavity over here. Okay, lesser pelvis. Okay. Right. So now this is the anterior aspect and this is the posterior aspect. This is the pubic symphysis and this is the sacrum over here. So pubic symphysis will be obviously on the posterior aspect. Is it or not? No, anterior aspect. Absolutely. Okay. So this is the anterior aspect which is called the anterior border of the ovary over here, which is also called the meso-ovarian border. What is it? Meso-ovarian border. Why it is called like that? Because meso-ovarium will be attached to this part of this ovary, all the way from the broad ligament. What is the broad ligament? Any idea? What is broad ligament? Any idea? No? So, okay, for example, the broad ligament means, for example, think that I am the uterus. Okay, so my hands are the fallopian tubes over here. Okay. If I hang two bed sheets over here, on either side, if I hang two bed sheets over here, just like the what? Wings, huh? So okay, what are wings? Not like wings actually, because it is two layered. We can't say it as wings. Okay. Okay. If I'm hanging, for example, if I'm selling the bed sheets, for example. Okay. If I'm selling the bed sheets in the local train, for example. Okay. So I'll be hanging the bed sheets on my hands over here. Okay. So this is the anterior layer and this is the posterior layer of the bed sheet over here. So the broad ligaments will be hanging exactly in the same manner. Getting it alright? This is the uterus, for example. For example, this is the fundus of the uterus over here, and this is a subperitoneal organ. But I am the uterus, which is subperitoneal organ. So peritoneal layer is above over here. Getting it alright? So if you be running over the urinary bladder and joins with the anterior abdominal wall, here it goes towards the rectum and joins with the posterior abdominal wall. Getting it alright? Whenever it is going over here, so this same anterior wall peritoneum will be reflected over the fallopian tubes in this manner. Getting it alright? So here there will be depression, there will be elevation, and again there will be depression over here. Getting it alright? So the peritoneum all the way coming over here and goes over the uterus and then fallopian tubes, and it will be hanging on either sides of the fallopian tubes over here. Got it already, everybody? Right? So in that manner, the peritoneal folds will be hanging over the fallopian tube. Okay, just like the bed sheet on the anterior aspect and posterior aspect over here. Getting it alright? So, if this is fallopian tube, for example, this is a fallopian tube over here. If I take it as horizontally, so the broad ligament will be hanging in this manner. Getting it alright? So this is the free margin of the broad ligament over here. This is the actual peritoneum, which is going in front and behind over here. Okay. But meanwhile, whenever it is going downwards, it will be hanging downwards on the anterior aspect and on the posterior aspect also. Okay. This is the broad ligament. For example, this is the posterior aspect of the broad ligament. There are two layers. One is anterior layer and one is posterior layer over here in this manner. This is the anterior layer, for example. This is the anterior layer and this is the posterior layer. This posterior layer will be giving rise to a fold of peritoneum that is called as the meso-ovarium, to which the anterior border of the ovary will be attached in this manner. Can you know it? Right? So from the posterior layer, this is the anterior layer, for example, on the anterior aspect of the fallopian tube. This is the posterior layer, this entire is the posterior layer, for example. And this will be giving rise to a fold wherever the ovary is present. This fold of peritoneum of the broad ligament's posterior layer is termed as a meso-ovarium, which is attached on the anterior aspect of the ovary, nothing but the anterior border of the ovary. Get it up? So here will be the fold of the meso-ovarium in this manner. Getting it out? Right? So here there will be whenever the meso-ovarium, which is a part of the peritoneum, which is attached over here, all the way from the posterior layer of the broad ligament over here, there will be a line of demarcation between the meso-ovarium and the ovary. Why that should be happening over here? This line is termed as line of Fury. Exactly. Okay. Why this line, white line of Fury? It's actually the white line of Fury. Why this white line of Fury occurs in between the ovary and the broad ligament over here? Because there is a transition of the epithelium all the way from peritoneum, nothing but the broad ligament over here, towards the ovary. Ovary is lined by which epithelium? Germinal epithelium. Of course, nuclear epithelium is outermost one, then followed with the germinal epithelium. And then, but the broad ligament will be having which epithelium? Squamous epithelium, nothing but the mesothelium, nothing but the serous layer. Okay. So the epithelium over here and here are different. So the transition between the two epithelium is marked as a white line over here. That is called the white line of Fury. Okay, we can see the viscera also. Very good. So because of the transition between the epithelium, there is a white line of Fury which is formed at the attachment of the meso-ovarium over here. Got it already? Right? So which contains upper end nothing but the tubular end, lower end nothing but the uterine end or pelvic end, and anterior border to which the meso-ovarium is attached over here. So by this you can understand ovaries are situated behind the broad ligament. Is it not? Not in front of the broad ligament, but behind the broad ligament over here. Okay. And then followed by the posterior border, which is a free border. Okay, which doesn't have any attachments over here. Okay, but where the fimbria of the fallopian tubes are related over here, if you see the relations of the ovary, in front will be the meso-ovarium, nothing but the broad ligament, which carries So this meso-ovarium acts as a hilum of the ovary. So obviously it will be carrying. Yeah, obviously. So which vessels will be carried over here? Yeah, to the ovary. Which vessels will be given over? Nothing but the ovarian vessels. Okay. Ovarian artery is a branch of abdominal aorta, straight branch of abdominal aorta. Okay. Right. So ovarian vein will be draining into gonadal vein, or the ovarian vein will be draining right side directly into the inferior vena cava, and left side perpendicularly into the left renal vein. Okay. In guys and girls it will be the same. Okay. So on the nerves of the ovary, like the sympathetic nerves, it should be carried from T10 and T11. So if there is an inflammation of the ovary where the pain will be radiated dermatopically. Exactly. Umbilicus and just below the umbilicus over here. Okay. So sympathetic nerves of the ovary are from T10 and T11 segments over here. Okay. But for the fallopian tube, it will be from T11 to L2 over here. Getting it out? T11 to L2 or T10 to L2, you can take that. So if there is any inflammation of the fallopian tube, salpingitis for example, because of the infection, where the pain will be radiated in the abdomen? Absolutely. From the lower abdomen till the genital region it will reach. Getting it out? So when there is a inflammation of the ovary or inflammation of the fallopian tube, the pain will be radiated towards the umbilicus and below the umbilicus over here. Okay, right. So let us see the relations. Antennae is related to the, what is it? Meso-ovarium, which acts as a hilum of the ovary, which is carrying the blood vessels and nerves in and out. Okay. And then towards the upper end there will be the fallopian tube over here. Okay. Fallopian tube, how it is oriented, it will be going above over here, and then it will be reaching the medial surface over here. Getting it out? So the fallopian tube will be going the fallopian tube is related to the ovary in this manner. Okay, try to understand this properly. So the fallopian tube will be going above the ovary and will be reaching the upper end of the ovary, and then turns medially and will be related to the medial surface over here. Okay, try to understand this. So fallopian tube is above the ovary, and also this fimbriae will be facing towards the upper end and partly towards the posterior border. Try to understand this properly. Okay. So this fimbria part is related to the upper end partly and to the posterior border towards the upper part. If you take this as the anterior border over here. Getting it out? Getting it or not, right? Getting it or not? So this is the anterior aspect and this is the posterior aspect. This is the medial surface of the ovary over here. So it will be going all the way in front of the ovary because fallopian tubes are comparatively in front. Getting it out? So it will be going in front. So that's why there is a broad ligament over here to which this anterior border is attached over here. Could you understand? Right? So this will be turning above the upper end over here and will be going towards the posterior border and turns towards the medial surface in this manner. Getting it out? So this is the direction of the fallopian tube. It will be going above and turns medial in this manner. Okay. So this fimbria are related to the upper end and partly to the upper part of the posterior border over here. Okay. You can see that the meso-ovarium is very much close to the fimbria over here. Getting it out? So the pathogens whichever enters over here, enters into the meso-ovarium or directly into the peritoneal cavity over here. Getting it out? So through which it can enter into the entire peritoneal cavity, leading to peritonitis over here. Okay. So where the ovum is released all the way from the ovary over here. Peritoneal cavity, but from which aspect? That is important. Posterior aspect. Okay, very good. So towards the posterior border, the ovum or the secondary oocyte will be released over here. Get it on? Not towards the anterior border over here. Get it on? So it will be released into the peritoneal cavity or directly into the fimbria over here. It will be released, the ovum or oocyte will be released into the peritoneal cavity or into the fimbria directly. What? Fimbria directly, pakka. Peritoneal cavity. First of all, the oocyte will be released into the peritoneal cavity. That's why the girls will be getting a pain called metal smudge. Have you ever heard metal smudge in physiology? Physiology not over, both uterus and everything. Okay. So in case of females of 28 days cycle, for example, in case of complete menstrual cycle, all the way from 2 phases, what are 2 phases, right? Proliferative phase and secretory phase. Okay, proliferative phase and secretory phase, and ovarian phase and bleeding phase are also there, isn't it? So in the middle of the entire menstrual phase, there will be release of the ovum into the peritoneum over here. At that time, the females will be getting a pain. Okay, on the 14th day, a mild, dull, aching pain in females can be noted. Okay, why? Because the ovum will be released into the peritoneal cavity. Okay, so what will happen? If the sperm enters into the blood, what will happen? If the ovum enters into the peritoneal cavity, what will happen? Histologically, you would have learned already. The sperm, if it is entering into the blood, what will happen? If the ovum enters into the peritoneal cavity, what will happen? So what? So what? Exactly. The sperm acts like an antigen within the blood. Blood will be carrying the antibodies continuously, right? So the sperm, if it is entering into the blood, it acts like an antigen, foreign substance. So anywhere, if you see the tract of the sperm passage, there will not be any blood contact, blood vessels contact. It will be through the mucosa only, it will be going. Okay. So similarly, the ovum, when it enters into the peritoneum, it will act like an antigen over here. Okay, that must be sucked into the fallopian tube and it will be delivered outside. Yeah, you know, whether it might be fertilized or unfertilized, it should be carried through the fallopian tube into the uterus. Okay, not into the bloodstream or any other area. But because the problem is it will be released into the peritoneal cavity, it acts like an antigen, so there will be inflammation of the peritoneum over here. That's why the females will be getting, in the middle of the menstrual cycle, a pain called the metal smudge pain. Okay, you'll be learning it later in physiology. Okay. So from this peritoneal cavity, this ovum will be sucked by these fimbria over here. Okay. What are these fimbria? Finger-like projections of the infundibulum part of the fallopian tube. Is it not? So this fimbria contains which structures? The fimbria contains cilia, and of course also all the sucking action will be occurring over here. Exactly, contraction of the smooth muscles which are present in the fallopian tube. So contraction leads to sucking action of the fimbria, and the cilia which are present over here will be carrying the ovum from one direction to the another direction over here. Okay. So this happens in between the fimbria and the posterior border of the ovary over here. Getting it out? Right. So towards the upper end, nothing but the tubal end, and towards the posterior border, upper end, there will be the fimbria which receives the ovum over here. Okay. And further behind, the relations further behind are internal iliac vessels over here. We have learned now triangle of, what is it? Triangle of internal iliac vessels, ureter, triangle of, what is it? Marcel, triangle of Marcel. Could you remember? In front of the sacroiliac joint, there will be internal iliac vessels. In front of the internal iliac vessels, or bifurcation of the common iliac artery. Okay? And in front of the bifurcation, there will be ureter, and in front of the ureter, there will be ovary. Could you remember on that? Triangle of Marcel, right? So behind the ureter, so behind the ovary, there must be structure over here. Behind the ovary, there must be a structure. Ureter, obviously. Here will be the ureter over here, and then followed by internal bifurcation. You can see that most preferably internal iliac vessels, because it is below the pelvic brim. You can say it as internal iliac vessels. Getting it? Okay. So internal iliac vessels and ureter will be the posterior relations after this fimbria to the posterior border of the ovary over here. Getting it? So what will happen if the ovary gets inflamed because of any infection, because of this relation over here? What is? Ureteric obstruction, okay, fine. Because of the inflammation, okay. Urethritis, first of all, the inflammation will be spreading towards the ureter. That leads to urethritis, inflammation of the ureter. And further, if it undergoes fibrosis, there will be obstruction. So if the obstruction of the ureter occurs, what will happen? A condition called, there is an obstruction of the ureter. condition called, which thing occurs? Hydronephrosis will occur. Very good. Hydronephrosis will occur. What is hydronephrosis? Yeah, but what is happening over here? Like hydronephrosis. The pressure will be reverted back to the renal pelvis and calyces over here. Okay, causing to damage of the substance of the kidneys over here. Okay. So behind the posterior there will be ureter, and behind that will be the internal iliac vessels over here. There you go, right? So towards the lateral aspect, what might be the relations of it? Towards the lateral aspect, there will be which structure towards the lateral surface of the ovary over here? Towards the lateral surface of the ovary, what will be the relation? Ovarian fossa. How the ovarian fossa will be formed over here? So this is the peritoneum going over here towards the lateral aspect of the ovary. So this is towards the anterior border, which is related to the mesoovarium. That is towards the posterior border, that is related to the ureter and iliac vessels. But towards the lateral aspect, there will be peritoneum running over the lateral pelvic wall. Is it not? Is it not? Right? Would you able to remember or not? See here, this is the anterior abdominal wall peritoneum, and this is the posterior abdominal peritoneum which is coming over here, for example. This is the posterior abdominal peritoneum over here. And on either sides also there will be peritoneal covering towards the lateral pelvic walls. Is it not? Right? So that, for example, imagine the iliac bone over here. This is the sacroiliac joint area. This is the sacroiliac joint area, for example. This is the sacrum, for example. This is the iliac crest and everything over here. This is the iliac crest and this is the pubis, for example. Okay, could you able to imagine? This is the lateral wall of the pelvis over here, greater pelvis and lesser pelvis over here, and the peritoneum will be going over this lateral pelvic wall. Could you able to remember or not? Right? So whenever it is going over here, it leaves a fossa over here. Okay, so it will be left by a fossa. This peritoneum will be giving a fossa over here. That is called the ovarian fossa. Okay, what's it? Ovarian fossa towards the lateral pelvic wall. Okay, so what is happening over here? So whenever it is over here, there will be just lateral to the ovarian fossa, they passes obturator vessels and nerve. Is it not right? Could you understand? Here there will be obturator foramen or not? Ilium, ischium behind and pubis over here. There will be obturator foramen over here, through which the obturator nerves and vessels will go over here, right? So those nerves and vessels will be lying lateral to this ovarian fossa. So if there is any inflammation of the ovary, what happens to the patient? Exactly, medial side of the thigh and knee will be getting pain. Because why? The obturator nerve is the nerve of the adductor compartment of the thigh over here. Okay, adductor magnus, brevis longus, and whatever the muscles will be. So those will be supplied by the obturator nerve, which passes adjacent to or lateral side of the ovary over here. So whenever this gets inflamed over here because of the inflammation or infection, whatever it might be, this nerve will get irritated over here. Okay, that will be passing towards the medial aspect of the thigh over here. So the pain all the way from here will be radiated towards this aspect over here. Okay, if any female coming with the abdominal pain radiating to the medial aspect of the thigh and the knee, this is the reason. Will you understand everybody? Okay. So there is if a female comes, so if a male comes with this, what do you suspect, right? The male complains of abdominal pain and pain in the thigh. See, will it happen in case of males? No, obviously ovaries are not present in males, so it will not happen in case of males. Okay, right? So still, if it happens in male, complaining of the pain, complaint of pain in the which region? Complaint of pain in the groin, and that is radiating towards the thigh, middle aspect of the thigh. What you will suspect? In case of males, instead of abdominal pain, there is a pain at the region of groin, for example. Where is groin? This part is the groin. Okay. The pain in the groin that is radiating towards the middle aspect of the thigh. What you will suspect? Yeah, where it can be irritated over here. Where it can be irritated over here. passing in the obturator foramen. Obturator foramen is close to which joint over here? Hip joint. If there is any arthritis of the hip joint, there will be pain in the groin region. So the obturator nerve will be irritated over here. That will be radiated towards the medial aspect of the thigh. Getting it alright? So abdominal pain with the medial aspect of the thigh pain in case of females, nothing but the inflammation of the ovary over here is over here. In case of males, it will be arthritis of the hip joint over here. That leading to the pain in the medial aspect of the thigh. Okay, getting it alright? So this fallopian tube, focus over here, this fallopian tube and the ovaries lower end. So far we have seen the upper end, anterior border, posterior border and anal surface also. Coming to the lower end, this lower end is connected to the lateral angle of the uterus over here. Where is the lateral angle of the uterus? So this is the lateral angle of the uterus in between the fundus and the body of the uterus towards the lateral aspect. This is the lateral angle of the uterus over here. Okay. So one thing you're supposed to understand, the lower end of the ovary is connected to the lateral angle of the uterus over here. Okay. For example, the ovary is present over here. So the lower end of the ovary is connected to the lateral angle of the uterus by means of a ligament called ligament of ovary over here. What is it? Ligament of ovary which connects the lower end of the ovary with that of the lateral angle of the uterus over here. Okay. But both the ovary and the fallopian tube is connected to the lateral pelvic wall by a fold of peritoneum over here. Okay, you can see the fold of peritoneum over here, which is hanging all the way from the pelvic brim. Pelvic brim will be over here. Get it out? So this is the lesser pelvis, and here there is a greater pelvis. In between that will be the pelvic brim over here, right? All the way from the pelvic brim and lateral pelvic wall, there is a fold of peritoneum which hangs the fallopian tube and ovary over here. That is called. That is called suspensory ligament of ovary. Two ligaments, one is suspensory ligament of ovary and the other is ligament of ovary. These two ligaments are very much important. Getting it on? Right? Suspensory ligament of ovary will be suspending the fallopian tube because it is vertically oriented and ovary is vertically oriented over here. So this is the direction of the suspensory ligament of ovary, which is hanging the fallopian tube and ovary all the way from pelvic brim and lateral pelvic wall over here. Okay, but the ligament of ovary will be connected to lateral angle all the way from the lower end of the ovary over here. So two connections. One is towards the lateral aspect, one is towards the lower aspect over here. So these ligaments will keep the ovary in position. Getting it down? So the ovary is freely hanging within the peritoneal cavity, but this will be kept in position by means of these ligaments above and below, and also one more fold of peritoneum, nothing but the meso-ovarium. Exactly. So meso-ovarium, the ligament of ovary and suspensory ligament of ovary keeps the ovary in position within the peritoneal cavity. Getting it down? Right? And one more thing is, all the way from abdominal aorta, the ovarian artery will be passing through this suspensory ligament of ovary and will be supplying the ovary and of course to the fallopian tube also. Getting it down? So you can see that this is the ovarian artery which is coming all the way from abdominal aorta but passes through this fold of peritoneum, that is nothing but the suspensory ligament of ovary, and enters into mesosalpinx. What is mesosalpinx? Histology over, you must be knowing. Mesosalpinx means? Meso-ovarium, mesosalpinx means what? Mesosalpinx, what is mesosalpinx? So what are the layers of histology? What are the layers of the fallopian tube? Histology not over. From today onwards, the osteology has started. Histology still is there. It's going on. Oh, okay, fine. It's okay. It's okay. So come on. Let us focus. So the fallopian tube is lined by which epithelium? fallopian tube is lined by which epithelium? Ciliated columnar epithelium. What are the specialized cells which nourishes the spermatozoa and ovary? I mean ovum. What right? Certainly cells. I'm asking about female. Of course. The sperm also is present over here, but both things will be nourished by specialized cells within the, along with the lining epithelium of the fallopian tube, which will be asked in the examination. What is that? That's what I'm asking again. Peg cells, exactly. What is the peg cells? Peg cells are like in this manner, club-shaped cells over here. Among the columnar cells, so those will be nourishing the spermatozoa, of course the sperms, and the ovum over here. Okay? So these peg cells will be asked in the examination. Okay? So these are the relations of the ovary above, below, and laterally. Okay? Clear or not, everybody? Everybody could able to imagine where the ovary is situated, right? Ovary is situated very much close to the sacroiliac joint. In front of the sacroiliac joint, there will be bifurcation of the common iliac vessels, and then followed by in front will be ureter, and then in front will be the ovary, which is situated within the ovarian fossa, which is formed by the peritoneum of the lateral pelvic wall over here. Getting it on? Right. So deep to the lateral pelvic peritoneum, there will be obturator vessels and nerves. Getting it on? Right? The ovary is also supplied by not only by the ovarian artery but also by means of uterine artery also. Partly by means of uterine artery also will be supplying the ovary over here. Getting it on? Right. Then coming to the fallopian tube. What are the parts of the fallopian tube? Already over now. Fallopian tube. Exactly. parts of the fallopian tube over here. All the way from the uterus till the ovary. What are the parts over here? First of all, about 1 centimeter there will be intramural part. What is that? Intramural. Intramural means within the musculature of the uterus over here. Okay. So intramural part. Ureter also will be having intramural part within the urinary bladder. Is it or not? Right? Intravesical part, intramural part you can say. Intramural part also you can say. Okay. And then further there will be about 3 centimeters of isthmus. The isthmus, the wall is thick over here. Why it is thick? Why the isthmus wall is thick? What is it's okay. So first of all, let us see. Okay, first of all, this is the intramural part, and then followed by isthmus, and then followed by the ampulla, which which is having thin walled over here, and thin walled and dilated. Is it not? Ampulla of the gallbladder, it is dilated part, and here also dilated portion of the fallopian tube is ampulla, and then followed by infundibulum. The infundibulum will be having finger-like projections called fimbriae. Okay, fimbriae or fimbriae. Okay, plural is fimbriae. Okay. So among this, the ampulla is dilated portion and thin wall, and isthmus is narrow portion but thick wall. What might be the reason? So it happens with the nervous system, sympathetic and parasympathetic system. So why it is dilated and thin walled over here? Why it is thick walled and narrower over here? So where the fertilization occurs in the fallopian tube? Ampulla, isn't that right? So ampulla, so enough space must be there for the growth of the zygote. Okay, so there will be enough space, and the secretions must be stored over there for some time, till for about 3 days or 4 days, till it reaches the uterus. Okay, so storage of the secretions over here, and the fertilization growth of the zygote occurs in the ampulla over here. That's why it must be dilated over here. And then why the isthmus must be thick walled and narrower over here? What is it? What is it? Cleavage? It will happen over here only. Absolutely. See here, in case of stomach, the pyloric sphincter is not open while churning. Is it not? While churning, the sphincter will not open over here. So after some churning happens, slowly it will open. Okay, so some amount of food will be delivered into the duodenum. In the same manner, the fertilization must be occurring over here, and some amount of growth of the zygote must be occurring over here. During that time, it should not be leaked into the uterine cavity. So this is narrowed over here. Okay. Okay, but later on, this will be slowly, because of the muscular contractions, it will pull the zygote to the uterine cavity over. Okay, so not to leak the fertilization process and the nutrition process over here, this is narrowed and thick walled over here. But later on, when the growth occurs over here, it will be sucked by means of the muscular contraction over here, and this will be pulled into the uterine cavity over here. That is the reason of it. Getting it on, right? So not to escape the fertilization contents over here, this is narrowed over here initially. But later, because of the muscular contractions, it will be dragging the zygote into that part over here. Okay, whatever the stage might be. Okay. So this fimbria will be having two sorts of epithelium. On the outer aspect of the fimbria, it is covered by, the outer aspect of the fimbria is covered by, see here, this is, if you see properly, this is the broad ligament over here on either sides. It will be piercing. The infundibulum will be piercing the broad ligament and entering into the peritoneal cavity over here. Could you understand? Ovary is within the peritoneal cavity. So the fallopian tube, to reach the fimbria, what are fallopian tubes over here actually? The subperitoneal or what? Try to imagine, right? Obviously subperitoneal, because uterus is subperitoneal and everything is going, that means the peritoneum is going above the uterus and the fallopian tubes. So obviously the uterine tubes are subperitoneal over here. Okay. So for example, this is on the way from anterior to posterior direction, this is a subperitoneal aspect over here. So for the fallopian tube to reach the ovary, which is situated over here, which is the peritoneal cavity structure over here. So the fallopian tube should pierce the peritoneum over here and should be entering into the peritoneal cavity. Do you understand? Right? This is a subperitoneal aspect over here. So fallopian tubes also covered by the peritoneal folds over here, nothing but the broad ligament over here. So the terminal portion of the fallopian tube or uterine tube must be piercing this peritoneum over here, overlying it, and should enter into the peritoneal cavity to reach the ovary over here. Getting around over here, right? So this fimbria are also within the peritoneal cavity to collect the ovum all the way from the ovary over. Getting it out, right? So whenever it is piercing this part, it will be having two sorts of epithelium. On the inner aspect, there will be ciliated columnar piercing over here, so it is partly lined by the epithelium of the peritoneum over here. So obviously there will be simple squamous epithelium, nothing but the mesothelium. Getting it out? So the fimbria on the inner aspect, not naturally, just like the other areas of the fallopian tube, it is lined by the ciliated columnar epithelium to suck the ovum all the way from the ovary over here. But whenever it is piercing, some amount of peritoneum will be dragged over here. So the outer aspect of the fimbria is lined by mesothelium. Getting it out? Mesothelium. So two sorts of epithelium in case of fimbria over here. Okay. So what might be the relations of the fallopian tube over here? What might be the relations of the fallopian tube? So wherever, what is mesosalpinx? Mesosalpinx means wherever the fallopian tube is covered by the broad ligament, that is termed as the mesosalpinx. Getting it out? Whenever you are hanging the bed sheets over here, this area of the peritoneum within which the fallopian tube is situated, that is called the mesosalpinx. That will be continued downward as broad ligament of the uterus. Getting it out? So when I am hanging the bed sheets over here, the anterior layer and posterior layer, these two areas are termed as the broad ligament. But whenever it is encircling the fallopian tube, that area is termed as the mesosalpinx over here. Try to understand the difference between these two. Getting it out? Right? So what structures will be lined in front and behind the fallopian tube over here? Okay. So behind the fallopian tube, there will be a structure which is connecting the ovary over here. What is that? See, there is the fallopian tube over here. Okay. So towards the lateral angle of the uterus, there will be two ligaments attached behind the fallopian tube and in front of the fallopian tube. Behind the fallopian tube, we have already seen this ligament, that is nothing but the ligament of ovary, which is connecting the lower end of the ovary with that of the lateral angle of the uterus over here. So this is one relation of the fallopian tube. Okay, another relation is in front of the fallopian tube, but below there is a ligament over here that is called the round ligament of the uterus, which is a replacement of the spermatic cord. Vast difference you can see. Okay. So the spermatic cord will be passing through the deep ring and superficial ring and will be reaching the testis over here. But the round ligament will be attached all the way from the lateral angle of the uterus in front of the fallopian tube over here and will be going towards the deep ring over here and then passes through the superficial inguinal ring over here and then enters into scrotal sac. Then labium majus or labium majora over here. Getting it or so this will be this broad ligament, this round ligament of the uterus will be attached to the skin of the labium majus or labium majora over here. So by this you can understand the uterus is connected to the labium majus over here. Getting it or in case of females there will be labium majora. What are labium majora actually in case of females? Normally, developmentally, scrotum and labium majora in case of females. Okay, scrotum is fused below with the median raphe underneath. So why these two things are coming? From where these two things are coming? The labium majora or the scrotal sac are coming from which structure? Developmentally. This is important. What is it? That is termed as genital swelling. Did you come across or not? Right? Genital swelling? Not yet. Not yet. It's okay. So just try to remember the labia majora, like the two skin folds over here on either side. In case of females, they will not fuse in the middle. Okay. So here lies the vestibular part, where the urethra, vagina, and everything comes out over here. In case of females, but in case of males, that will be fused over here and forms the scrotum. You know? So the scrotum on the underneath will be having a median raphe. What is raphe means? Raphe means what? On either side, the fibers are intermixed with each other, okay, interdistant with each other. So this area is termed as a raphe over here. Getting it out? So the median raphe, the skin is fusing over here, leaving a black colored line over here. That is called the median raphe below the scrotum or in the center of the scrotum. For example, this is the right sac of the scrotum, this is the left sac of the scrotum. In between these two, there is a line over here that is called the median raphe in the adults over here. That is because of the fusion of the, what is this? Genital swellings over here. So this terminology is important. What is it? Genital region swelling. Genital swelling on either sides will be fused in case of males and forms a scrotum, but genital swelling in case of females will not be fused over here. That's why in between these two there is a gap over here that leads to what the projection of the clitoris or vagina or whatever it might be, urethra or whatever it might be. Getting it out? Right. We'll be seeing that. Okay. So in front, see here, this is the fallopian tube. Behind will be the what is it? Ligament of ovary. In front will be the round ligament. But these are related posterior-inferior and antero-inferior. Getting it out? So for example, this is the fallopian tube. The round ligament will be going over here in this manner. It will be related antero-inferiorly over here towards the lateral angle of the uterus. And ligament of ovary also will be lying postero-inferior over here, connecting the ovary with that of the lateral angle of the uterus over here. Okay, that is one relation. And obviously below the fallopian tube there will be running uterine tube, uterine artery over here. So uterine artery is a branch of iliac artery, absolutely. Which division? Anterior division. Okay. So this is the ovarian artery over here. Uterine artery will be going all the way from below upwards. How the uterine artery is related to the ureter over here? For example, this is the ureter. For example, this is the ureter over here. How the vas difference is related? Vas difference will be related going all the way from the superficial inguinal ring and then forming a deep ring over here and then goes above the ureter and reaches the seminal vesicles over here. Is it not right? So how the ovarian artery in case of females reaches? It will be arising all the way from the which artery? Interiliac artery. For example, this is the interiliac artery. That will be giving rise to a branch called the ovarian artery from the anterior division. That will go above the ureter and reaches the uterus over here. Getting it done? So the vas difference in case of males and uterine artery in case of females will be having the same sort of relation with that of the ureter over here. Getting it done? Right? So the vas difference in case of males will be going above the ureter and reaches the medial aspect of the seminal vesicles. And in case of females, from the interiliac artery, from the anterior division, there arises an artery called the uterine artery that will be going above the uterine artery over here. This uterine artery will be lying close to the here, this is the lateral wall of the uterus over here. So just the ureter on the medial aspect lies the uterus and vagina in relations. Could you remember or not? Whenever the ureter is going all the way to the urinary bladder, could you remember the relations or not? Right? Pelvic part. What are the three parts of the pelvic part of the ureter? And again oblique. Vertical which lies over. Vertical which lies over. Not sacroiliac joint, over pelvic brim, it's okay, much more, further, almost close. No? This pelvic part and the abdominal parts of the ureter are important, right? Theoretical and practical also. That's why I'm stressing again and again. So what are the three parts of the pelvic part of the ureter? One is the vertical part, second one is the oblique part, and one more is the oblique part or intramural part. The vertical part will be lying, I have shown you in the bone also, right? Right? So where is that region? Is that region in front of the greatest sciatic notch? Is it or not? Pelvic surface of the ilium. Will you remember or not? Yeah, whenever it reaches the skill spine, it will be turning into the second part, which is the oblique part, which directs obliquely downwards, forwards, and medially. Okay, then enters into the wall of the bladder, which is called the intravesical part and intramural part. That is again obliquely directed. Okay, don't forget. Okay. So the uterine artery, how it is related? This is the interiliac artery. You can see that. This is the ovarian artery. That will be overlying over the ureter and reaches the lateral wall of the uterus and goes over the lateral wall of the uterus and anastomoses with the ovarian artery at a lateral angle. Try to understand this. If you take the uterus over here, this is the lateral wall of the uterus. Okay. Uterine artery will be entering all the way from the lateral wall into the broad ligament over here. Okay. So the ovarian artery is also situated within the Mesosalpinx, nothing but the part of the broad ligament over here. And here absolute broad ligament will be present over here. In between the two layers of the broad ligament, the uterine artery enters towards the lateral aspect of the uterus over here. And then it runs upwards over the lateral wall of the uterus, and whenever it reaches the lateral angle of the uterus, it anastomoses with the ovarian artery over here. This ovarian artery is situated within the mesosalpinx over here, but the uterine artery is situated within the broad ligament over here, actual broad ligament over here. But the anastomosis occurs at lateral angle of the uterus. This part is very much important. Okay, ovarian artery will be coming all the way from the abdominal aorta, passes through the ligament of the ovary, and then enters into the mesosalpinx. Okay. But uterine artery all the way arises from the internal iliac artery and enters into the broad ligament laterally and goes upwards by the side of the lateral wall of the uterus and reaches the lateral angle of the uterus over here. Okay. So at this lateral angle, both ovarian artery and uterine artery will anastomose with each other. Got it on? So these things are important. In the mesosalpinx there will be ovarian artery. In the actual broad ligament there will be uterine artery. Both will be anastomosing with each other at lateral angle of the uterus. Lateral angle of the uterus is very much important because there will be intramural part and isthmus. The junction will be there, and in front and below will be the round ligament of the uterus. In front, behind and below will be the ligament of ovary, and this anastomosis also will occur at the level of the lateral angle. So lateral angle of the uterus is very much important theoretically and practically as well. Getting it out or not? Right? So obviously the uterine artery will be supplying the uterus, and of course the fallopian tube also. Okay, fallopian tube is supplied by because there is an anastomosis over here, so it will be supplied. The fallopian tube is supplied by both ovarian artery and uterine artery also. Ovary is also supplied by both ovarian artery and uterine artery also. Okay, so these both will be supplying equally to the uterine tube over here, but the ovary is mainly supplied by the ovarian artery and partly by the uterine artery over here. Getting it on? Right? So the ovaries and the fallopian tubes are supplied by two arteries, ovarian artery and uterine artery. Okay. So So because in case of females, it is an open type of peritoneal cavity, what will happen? The pathogens will be entering through the vagina and into the uterine cavity, and then enter into the fallopian tubes, and finally into the peritoneal cavity or into the mesoovarian. Okay. So whenever it is traveling over here, for example, there is a tuberculosis bacilli. Tuberculosis bacilli. Bacilli means okay, you will running it right. Okay, bacillus means rod-shaped bacteria. Okay, so tuberculosis. Okay, tuberculum bacilli over here. If it is entering through the uterus over here, so what might be the complication which occurs in the patient over here? What happens to the patient? See, the tuberculosis occurs in case of small intestine. What will happen? Macrophages, okay. Fibrosis. Related to the fibrosis of the matter over here. For example, there is a peculiar sort of fibrosis in case of tuberculosis. For example, if you take the lumen, for example, if you take the lumen of the either intestine or the fallopian tube over here, so what will happen? The tuberculum bacilli will be over the entire circumference of the lumen over here. This is a peculiar feature of the tuberculum bacilli. Try to understand this, okay? For example, this is either intestine or the fallopian tube, whatever it might be. Okay. So the tuberculum bacilli will be invading the entire circumference of the tube over here, the intestine or the fallopian tube. So whenever it occurs, there will be inflammation. Inflammation occurs around the tube over here. Get it out? So whenever there is an inflammation further continues, there will be fibrosis. There will be fibrosis here and there in the okay. Whenever there is a fibrosis, what will happen? The lumen will be narrowed and irregular. So what it leads to? Obstruction, exactly. So whenever the lumen is narrowed because of this fibrosis, in case of tuberculosis especially, either small intestine or in case of fallopian tube, This fibrosis will be irregularly arranged within the lumen of the intestine or fallopian tube. That leads to obstruction of the intestine or obstruction of the fallopian tube. Obstruction of the intestine, we know what will happen. What will happen is the small intestine is obstructed. What will happen? With what symptoms the patient will come? For example, if there is a tuberculosis infection to the second part of the duodenum, for example, what the patient will be presenting with? So the patient got tuberculosis infection, not through respiratory tract, but through the gastrointestinal tract. So the infection has reached the second part of the duodenum, clearly second part of the duodenum over here. Okay. So the patient have been taking the food normally, just like a regular process, is taking the food. But whenever the fibrosis has invaded the entire lumen, papilla will be obstructed, almost all closed, not papilla, some other thing. What will happen? Absolutely, obstructed bilateral pancreas is okay, fine. What I'm saying is, for example, this is the duodenum over here. This is the duodenum. So the obstruction has occurred over here. It's exactly over here. And here is the major duodenum papilla and minor duodenum papilla over here. Okay. So the patient has been normally taking the food over here. Patient has been normally taking the food. What complaints the patient presents to the casualty or general medicine opinion? Okay, because it's a tuberculosis infection, the patient presents with the fever. Okay, and of course, because of the infection and inflammation of the intestine over here, he also presents with the abdominal pain because of the inflammation over here. And further, but the patient has not been taking care of himself, so further there is an obstruction of the second part of the duodenum over here. So what is happening over here? So the patient will be taking the food over here. It will not cross the second part of the duodenum over here. Okay, but there will be secretion of the bile and the pancreatic juices over here. Is it not right? So whenever the patient can't be able to pass the food through the second part of the duodenum, what happens next? There is a term called, you only told it last time, reverse peristalsis will occur. So reverse peristalsis will occur. Now the peristalsis will occur all the way from above downwards over here. But whenever there is an obstruction over here, there will be reverse peristalsis occurs over here. So that leads to vomiting. But because there is a bile secretion over here, the vomitus will be in which color? Green in color. So if there is any green colored vomiting occurs, then you can understand there is an obstruction in the second part of the duodenum. That might be because of tuberculosis or any other reason. Getting it or not? So the same obstruction occurs in the fallopian tube. What will happen to the patient? The patient presents with what? The fallopian tube is blocked in the same manner over here, any of the fallopian tube. Okay. So if the fallopian tube is on either side, it is blocked. Which happened in Aishwarya. You know very well, right? Aishwarya Rai? Abhishek's wife. Abhishek Bachchan's wife, right? You know that? So what will happen if the tuberculosis infection occurs in case of fallopian tubes? What the female patient lands up with? Exactly, infertility. Absolutely. So if there is an obstruction, so if there is any obstruction within the fallopian tube because of the tuberculosis infection, come on, give up Aishwarya Rai, just focus over here. Okay, so for example, there is an obstruction of the fallopian tube over here because of the tuberculosis infection. So what will happen? The patient the patient lands up with infertility because the sperm can't reach the ovum over here or oocyte over here. So obviously there will be infertility in case of females, obviously. Okay. Further, what might happen? For example, if there is any other infection, for example. So if there is another infection reaching the fallopian tube, so what will happen in the fallopian tube? Leave over the tuberculosis. This is a peculiar feature of the tuberculosis which is encircling the entire circumference of the lumen and obstructing the lumen. Inflammation that leads to? Okay. So infection reaches the fallopian tube over here and there will be inflammation and the pus formation over here. Is it not? So whenever the pus formation occurring within the fallopian tube, it is termed as what is it? Pyosalpinx. Okay. So with what complaint the patient might present with? Imagine, okay. The infection other than tuberculosis has reached the fallopian tube over here. It is being lodged within the fallopian tube over here. That is leading to proliferation of the bacteria over here. So obviously the pus will be accumulated within the fallopian tube. So what complaints the patient will be presented with in the OP? Lower abdominal pain, and then fever will be there because of the infection and inflammation, of course, and then further. Exactly, the pus will be discharged into the peritoneal cavity over here. You will understand, right? So the pus will be delivered later on into the peritoneal cavity, leading to initially localized peritonitis, later on generalized peritonitis. So initially there will be lower abdominal pain, localized pain, but later on it will be the entire abdomen will be under pain. Getting it on? So this is a complication of this biosalpinx. Biosalpinx means pus, bio means pus within the fallopian tube. So because there is no other go over here, it will be reaching the peritoneal cavity over here. That's why peritoneal cavity in case of females is open type. Okay, right. So for example, normally the fertilization occurs within the fallopian tube over here. With the what is this? Ampullus, okay. The zygote, if it can't able to escape into the, of course, hormone and everything will be there. Which can't escape into the uterine tube after 3 days or 4 days. So the growth of the fetus will occur in the fallopian tube. That is called tubal pregnancy or ectopic pregnancy. Ectopic or tubal pregnancy. Okay, whatever might be the reason. So ectopic pregnancy means whenever the pregnancy occurs within the fallopian tube, that means the growth of the fetus occurring in the fallopian tube. What might be the compliance with which the patient lands up in the OPD or emergency? This is very much important. So the pregnancy occurring within the fallopian tube over here, the fetus will be growing within the fallopian tube without reaching the uterus over here. So what will happen? The fallopian tube will be burst open. So obviously this will be, the fetus will be leaked into the peritoneal cavity. Leave about that. Okay. The fetus can be removed later with the surgery. What happens to the patient over here? Female patient. No, that's a different thing. So that is antigen is a smaller thing. Ovum will be very much smaller. Sperm is also very much smaller. You can't even see with the naked eye. Okay. Internal hemorrhage, that is the main thing. So that's why initially whenever the baby is growing within the fallopian tube, the patient might complain the pain in lower abdomen on one side. But the pain will be slowly increasing, initial stages. But later on whenever the patient neglects over here, so the fallopian tube will be burst open. That leads to internal hemorrhage. Why? Because there is a ovarian artery and ovarian artery will be very much close to the fallopian tube over here. That will be ruptured and opens up. That leads to internal bleeding, and the patient will die of internal bleeding over here. So this is initially the pain abdomen, but that is the emergency with which the patient dies of with the internal hemorrhage over here. Get it on? So the question will be asked in this manner. So the patient is having the pain in the lower abdomen, okay, on both the sides, complaining of the fever and body pains, and the patient complains of she can't able to become pregnant even after cessation of the menstrual bleeding for about 3 months. 3 months or 4 months, whatever it may. Okay, so what might be the reason? You can say it as tuberculosis infection. And the same patient complaining the pain and swelling within one side of the abdomen over here, lower abdomen, and she is not having the menstrual bleeding since 3 months over here. Okay, pregnancy will be diagnosed after 3 months of cessation of the menstrual bleeding. Okay, temporary cessation of the menstrual bleeding. Right? So the patient is complaining of pain and swelling in the one side of the abdomen, and last menstrual period some 3 months back. Okay, she is not getting the menstrual period for about 2 months continuously. Okay, and patient is complaining of intense pain over here. Okay, but there is no obstruction to the intestine. How we can ask the flatus passage, or is we have to ask the flatus passage and urinary passage. So if they are normal, there is no intestinal obstruction. But there is swelling constantly. That in case of females, we have to think of ectopic pregnancy. So sudden onset of the pain and sudden loss of consciousness, and with abdominal swelling on one side, you can think of ectopic pregnancy. Burst open ectopic pregnancy. Okay, in this manner the questions will be asked over there. Can you get on? Let us see the visual.